Hi there, thanks for being here today. Let me ask you a question. Are you a man over the age of 40, maybe 50 or even 60, and your energy is dropping, your belly is growing, your motivation is not just what it used to be? It's not your fault. I guarantee you it's your testosterone. So stay right here, you're in the right place. I'm Terry, I'm 64 years old, and I help men in their 40s, 50s, and 60s restore their testosterone, rebuild strength, and reignite the fire they thought they'd lost. On my channel, I share hormone-focused nutrition, muscle and strength building, stress management, and anti-aging methods that actually do work. And I'm not just teaching this, I'm living it. I feel stronger, clearer, and more alive now than I did when I was in my 30s because of the methods that I share with you. So if you're ready to take back your physique, your mindset, and your masculinity, you are in the right place. Now let's jump into today's video. TRT for men over 40, the truth before you start. So let's go. Here's our medical disclaimer, and it's just important to note that your medical practitioner should always be consulted before beginning any new program that involves exercise, nutrition, wellness, or health. So what is TRT? First, let's break down what TRT actually is. It stands for testosterone replacement therapy. As I said, it's a medical treatment that boosts low testosterone levels using gels, injections, or pellets, and even oral tablets as we go forward in 2026. You must understand that the word replacement is the key to understanding what this treatment is actually about. Think of it like topping off your car's oil when it's running low. But here's the catch. TRT is not for guys with normal T levels. TRT is a substitute for your body's natural testosterone production engine because your own system is currently or may be permanently suppressed. TRT is prescribed for hypogonadism, clinically low testosterone. That is specifically total testosterone of less than 300 nanograms per deciliter. When you get your blood panel done with your doctor, you'll be able to discover this. This is not a magic fix. It is prescribed drug treatment for a specific medical intervention treatment. So let's dig into the science. For all men, your testosterone peaks in your 20s. Then it begins to drop 1% per year after the age of 30. By age 40, nearly 40% of men have low testosterone. What are the symptoms? Well, generally it's fatigue, brain fog, shrinking muscles, belly fat, and yes, bedroom issues, diminishing sexual performance. A recent study from the Journal of Clinical Endocrinology confirms that this is not just aging, it's a medical condition that in most cases can wreck your quality of life if not addressed. So here are the common symptoms of low testosterone in men over the age of 40. The first one is constant fatigue. You're tired all the time and you really don't know why. Mood swings, brain fog, and reduced motivation, even depression. The next one is poor sleep quality. Then you have low libido and diminished sexual performance. This all leads to the following conditions. You're going to get excess belly fat, you're going to lose strength and muscle, and the worst one for most men is hypogonadism, clinically low testosterone, and testicles that just don't function normally. So for the right candidates, TRT can be life-changing. Here's what the research says. Energy and focus improves. So say goodbye to your 3 p.m. afternoon crashes. Muscle and fat loss. You're going to be able to rebuild muscle and torch your belly fat if you engage in a strength training program. You're going to get a boost in your libido. The Journal of Sexual Medicine study recently found that TRT improves erections and satisfaction. Your mood will improve and your bones will get stronger. Slash depression risk and strengthen your bones. But, and this is a big but, TRT is not risk-free. So we need to talk about the side effects. So I'm going to mention the potential side effects. So initially, you're going to get potentially acne and oily skin. Your testosterone revs up your oil glands, and this will probably be experienced usually by a younger guy, so it's not really a critical issue for guys that are older, I believe. The one to really watch is blood clots. So you're going to get your regular blood test done and monitor your red blood cell count. You want to measure this situation to make sure that your blood is not thickening, basically, to increase your risk of blood clots. Sleep apnea. TRT can worsen your breathing issues, and sleep apnea is no joke. So if you're developing this, you've got to really be careful with it, because you're going to have heart condition problems if it is not treated properly. The other one is prostate concerns. Well, TRT does not cause cancer. It may fuel existing tumors. Infertility, this is a common one. Long-term TRT use can and will nuke your sperm count. Anxiety. So if your TRT dosage is too high, it may increase your anxiety in some cases. So having an extremely high testosterone level is not necessarily good. You're aiming for a testosterone balance. Some studies have also linked TRT to general heart risk though the data is mixed. So what is the bottom line? The decision to use TRT is a serious one. If you decide to start TRT, you must be closely monitored in terms of your blood work by your medical health professional. Next, blood work is absolutely necessary to establish your hormonal baseline. Here are the 7 essential blood tests that you need. So just take a look at this chart. What I've done is I've listed here the 7 essential tests that you need to get a full picture of your hormonal baseline. I've also listed here the normal ranges from age 40 to 70. It's a wide range here, but you can kind of look at this and get an idea where you stand in this picture here. So is TRT right for you? Let's break it down. If you have 3 or 4 of these low testosterone symptoms, then get tested. Preferably get a complete male hormone blood panel. If your total testosterone measures under 300 nanograms per deciliter, you might qualify for TRT. Check your symptoms. Low testosterone is not just about numbers. It's fatigue, low libido, depression, brain fog, muscle loss, and a host of other symptoms that you may have. Fix your lifestyle first. Clean up your diet, upgrade your sleep quality, and manage your stress factors, as many guys boost their testosterone naturally by making these adjustments without having to resort to using drugs. Now, if you make all these changes and you're still having issues, talk to your health care professional and get started on your TRT program, but make sure that you do this with the doctor's supervision. Do not do it alone. You want to monitor going forward any changes in your red blood cell count, any negative mood changes that may arise, or any other side effects that you experience during the treatment, so that you can make adjustments to either maybe the frequency of the application or the dosage. But don't do it alone. Do it with a doctor's care, and make sure that you're not encountering any negative issues. You have several options for applications. Testosterone injections are one of the most commonly used forms of testosterone replacement therapy due to their effectiveness and relatively low cost. These injections deliver testosterone directly into the muscle, ensuring a steady release of the hormone into your bloodstream. There are 2 primary types of injectable testosterone. There is cypionate and enanthate. Cypionate has a slightly thinner viscosity and is therefore easier to inject, and has a slightly longer half-life, about 8 days. Both are generally long-acting esters that require administration every 1 to 2 weeks, although specific regimens may vary depending on individual needs and your healthcare provider recommendations. For men with severe testosterone deficiencies, injections will provide rapid symptom relief, improving your energy levels, your mood, and libido within weeks of starting the treatment. Additionally, injections allow for precise dose adjustments, enabling your healthcare provider to tailor the therapy to your unique requirements. Some men may experience fluctuations in testosterone levels between doses, which can lead to mood swings or other symptoms. Despite these challenges, though, injections still remain a reliable and widely used option for TRT. Then there's topical gels and creams. They're another form of TRT. They offer a convenient and non-invasive method of testosterone delivery. These products are applied daily to your skin, dry skin on areas such as your shoulders, upper arms, or abdomen. The testosterone is absorbed through the skin and enters the bloodstream, providing consistent hormone levels throughout the day. The daily application allows for steady hormone levels, reducing the risk of peaks and troughs associated with other delivery methods. However, there are several considerations when using topical TRT. Proper application is critical to ensure adequate absorption and to avoid contamination of clothing or household surfaces or accidental transfer of the gel to others, particularly women and children, as this can lead to unintended hormonal effects. Then there's transdermal patches. These patches are less commonly used as a form of TRT, but they offer unique advantages for certain patients. These patches are applied to the skin, usually on the back, abdomen, and thighs, and deliver a controlled dose of testosterone over 24 hours. Despite these benefits, transdermal patches have notable drawbacks. Skin irritation is the most common side effect, as prolonged contact with the adhesive can cause redness, itching, or rash. For this reason, patches are often considered a secondary option for men who cannot tolerate other forms of TRT. Then there's oral and buccal forms of TRT. They represent another option for men seeking a non-invasive treatment method. Oral testosterone in the form of tablets or capsules is absorbed through the digestive system, while buccal tablets or lozenges are placed between the gum and your cheek, allowing testosterone to be absorbed directly into the bloodstream through the oral mucosa. Oral testosterone formulations have historically been associated with liver toxicity, as the hormone must pass through your liver before entering the bloodstream. Modern formulations such as testosterone undecanoate have addressed this issue by bypassing the liver entirely, but caution is still advised. Innovative delivery methods are continuously being developed to improve the convenience, safety, and effectiveness of TRT, and one such advancement is implants, which involve the insertion of small pellets containing testosterone beneath your skin, typically in the buttocks or abdominal area. Another emerging option is nasal gels, which are applied inside the nostrils using a small applicator. This method allows for rapid absorption of testosterone through the nasal mucosa, providing a convenient and non-invasive alternative to traditional forms of TRT. As with other forms of TRT, a thorough evaluation and consultation with your healthcare provider is essential to determine the most appropriate treatment option. TRT is not a fountain of youth, but for men with true low testosterone, it is a game changer. But proceed with caution. Do your homework, partner with a trusted doctor, and weigh the risks. Your health is too important for shortcuts. If you have 3 or 4 of the low testosterone symptoms that I've identified, visit your doctor as soon as possible. Get a full blood panel of the 7 essential blood tests that I've mentioned. And this is to establish your baseline, of course, and assess your current hormone health situation. Discuss your symptoms and your hormonal blood test with your doctor and proceed with your plan from there. So there you have it. That's TRT for men over the age of 40. So TRT should only be a last resort, only after you have implemented all the proven, effective, natural strategies that you can undertake to get you healthy and restore your testosterone to a normal level. Again, I emphasize, you must realize that TRT is what's known as exogenous testosterone. That means it is essentially a foreign entity which is being introduced into your body and actually replaces your natural testosterone production system. So eventually your own body will shut down its natural production because it's not needed, or may not ever come back post-TRT therapy. And I believe that's a problem that a lot of men are having that have been on TRT for years. There's a lot of factors at play here as to what will actually happen in your own personal situation. So no guarantees either way. You will need to make your own personal assessment of the risks and decide what is best for you. So check out the link below in the description and get your free Quick Start T-Boosting checklist. Got a lot of information in there just to help you get started. Are you ready to take control? Hit the like button, drop your TRT questions below, and subscribe. Look for my next video on testosterone optimization and anti-aging methods for men over the age of 40. Have a great day.